Hi everyone, this is our weekly blog, and one of the questions that was put to us through our Facebook account was how do I set up the flow of patients now? How do I present our plans, our health plans to new patients? What's our current procedure? And so I'm going to spend a few minutes and explain that to you. It used to be in the past that people would come to us and we would set up 3 or 4 acupuncture visits. And in the course of those visits, we would present our clinic. We would talk about Chinese medicine, how it works for them, and we would have them do 2 or 3 visits so that the patient could see clearly that the acupuncture works extremely well. And then we would present a plan. And of course, there's fallouts. There's people who wouldn't go beyond the first treatment because maybe they didn't like the needles or something like that. Okay? Well, over the years, we've changed, and we just got better and better at presenting what we do. And so a lot of our presentation now is in a printed format. So we don't take the time anymore to sit and explain Chinese medicine to patients. We give them a nice, beautiful, decorated portfolio when they come in, or a folder. And in the folder is a lot of information about the clinic and what Chinese medicine does and how aging is the aging of the vascular system and so on. We give that to the patient. We're not exactly sure if they really read all of it, even though we encourage them. But what we do now is pretty unique. We sign people up at events, or people call in at the front desk and we book an appointment. That appointment is usually about a half hour with myself or my chief resident, Kylene, who's been with me for 7 years. And that appointment is $150. And if they pay in advance, it's $60. So, of course, everyone pays in advance. Paying in advance is important because then the patient generally will show up. Because if you book a half hour and the person doesn't show, it's very disruptive to a clinic. So we have to make sure that the patient shows. So they pay the $60 over the telephone, they book the appointment, and they come in.